A huge thank you to our own Class 22 member, Min Win, a talented dentist and a musician and a pianist and, as it turned out, an organist. Please give a round of applause for his playing. Thank you. Okay, please be seated. Dear Penn Dental Class of 2022, faculty, staff, families, and friends, I am truly honored to open today's commencement events celebrating the graduation and the achievements of Class of 2022. What a joyous occasion to finally meet all of you in person after 3 years hiatus. We thought this moment would never come, but seeing your smiling faces, even underneath those masks, is a truly special event. While the last 2 years and a half have been personally challenging for each one of you, as well as for our school, our city, our country, and indeed for the entire world, today is the time to rejoice and recognize the truly outstanding achievements of your class. Despite the limitations and lockdowns of the pandemic, your class has graduated with the most extensive clinical experience in school's history. And of course, let's not forget the fact that you are the first class to have passed the integrated national boards with a 100% passing rate. Your class has enriched us in its diversity, as it included students from all corners of the globe, including international students, first-generation Americans, underrepresented minorities, individuals from socioeconomically disadvantaged backgrounds, first-generation students, political refugees, to name just a few. You have arrived here from 24 different countries, and in addition to English, you speak 32 languages and dialects, thereby creating our own version of the United Nations. In the Penn tradition, our school has produced graduates who are committed to lifelong learning and the pursuit of knowledge. In addition to the very extensive and intensive curriculum, and boy did we ever hear how intensive it is, you have enrolled in the 10 available honors program, and 9 classmates have completed master degrees in one of the other UPenn schools. 100 of you will be continuing your education in various specialty in general practice residency program. 20 will be joining the U.S. Armed Forces in various capacities. Some of you will go to private... Some of you will go to private practice and choose to specialize later on. Commencement ceremonies always evoke mixed emotions. That of sadness as we say goodbye to colleagues and friends, that of reflection on closing a significant chapter in our lives and feeling of pride and satisfaction as we welcome you to the global Penn Dental family. Let me conclude by quoting the ancient Celtic prayer, "May the wind be always at your back, may the sunshine warm upon your face, the rains fall soft upon your fields, and until we meet again, may God hold you in the palm of his hand." Thank you. It is now my pleasure to introduce our Dean, Dr. Mark Wolf, Penn Dental Medicine's Morton Amsterdam Dean. Thank you.
I'm going to ask any of those that are not wearing a mask to please put one on. If you don't, I will have you escorted out. Please don't ruin the graduation. Oh, I have to take a picture for my mother. 90 years old. She wants to know what her son is doing. All the time checking up. Well, good afternoon, everybody. I'm glad to welcome honored guests, faculty, staff, family, friends, and alumni, and soon to be alumni, the class of 2022. It's really great to have an in-person event here. And it took an awful lot for us to get here. It's a very special day of celebration here live on the Penn campus in this Irvine Auditorium, an incredible facility. Sorry for those of you that are in the nosebleed seats, but you can hear us really well. I hear the acoustics are exquisite in the building. We have hundreds literally tuned in right now who are watching in multiple countries, alumni, friends, and family. So we say welcome to everybody else. So life is filled with firsts. This is the first dental class sitting here today after a pandemic. For most of you, it's the first time, it's the first time you've graduated dental school. For a small number of you, about 30, 40, this is the second time you've graduated dental school, having graduated from a foreign dental school and then come to the United States to get your dental degree. Yes. It's an incredible journey for everybody, and you know, it's taken so much to get here. These times are unprecedented for you and me at Penn Dental. Well, are they really unprecedented? For Penn Dental Medicine, the Spanish flu hit Philadelphia in 1918, and quoting from the official record, dental students helped fight the 1918 influenza epidemic, and our school was actually closed for a short period of time, 2 weeks. While dental students actually had to dig graves and help move the gravely ill. At that time, quite remarkably, since we're talking about dentistry, they thought that it was spit that was spreading the disease, so it was kind of an interesting event. That pandemic raged on for years afterwards and killed 600,000 Americans at a time when our population was less than a third of what it is today. So, to our graduates, do you remember what you were doing in the fall of 2017? I'll give you a hint. You were applying to one of the historically great dental schools to be a student. By coincidence, at that same time, I had the opportunity to apply to be dean. You could have applied to be dean too. I'm not sure you would have gotten the position, but it would have been worth a try. But both of us came here, all of us came here for a specific reason. It was Penn Dental Medicine's reputation for innovation, science, and leadership that made all of us think that this was an important place to be. We applied because of its legendary reputation for innovation in dentistry and Penn's ability to raise the profession to new heights. A Penn Dental Medicine graduate of our first class, W.D. Miller, defined the cause of tooth decay. He talked about the relationship between fermentable, you guys got this lecture, right? It could be the last quiz. And why it creates decay. Before that, it was thought that bacteria actually just ate the outside of the tooth and made holes. Matthew Cryer created the first hospital-based dental service in 1901 and helped define oral surgery with his textbooks as a professor of Penn. Now we would call it oral and maxillofacial surgery. Lester Burkett of oral medicine actually defined the discipline of oral medicine worldwide, and barely a dental student in the world or a dentist today did not study from one of Lester Burkett's textbooks. He was dean here from 1951 to 1972. Periodontal care and saving teeth were defined by Dean D. Walter Cohen and one of his wonderful compatriots, the person for which my deanship is named, Morton Amsterdam, a prosthodontist. They defined saving teeth in the 1960s, 70s, and 80s, and actually defined what dentistry would become in the generation after. Dr. Marjorie Jeffcoat, Dean Jeffcoat, helped define the dental systematic disease link and bring that forward into prominence. Today's faculty are defining modern ceramic dentistry, CAD/CAM dentistry, care for persons with disabilities, cancer care, the causes of inflammatory disease and what that mechanism is. We're using nanotechnologies in dentistry. We're developing new vaccines for herpes, plant-based chewing gums to kill COVID-19. The list is exhaustive. These are just the people at Penn Dental Medicine. I'm not going to talk about the fact that the mRNA vaccine was invented at the University of Pennsylvania. Telling the Penn Dental Medicine story would not be complete without discussing our impact on our community. As students, you experience firsthand how quality oral health care can bring a smile to a child, make an elderly person feel young, recognize a veteran for their service to our country, and deliver care to someone with a physical or intellectual disability. Better oral health for so many would have been unattainable without the care available at the schools, patient care centers, and community sites. So many of you have gone above and beyond to meet the community's needs. You have been the safety net healthcare provider for persons with disabilities who could not find a dentist anywhere else. Many of you were the healthcare bridge for persons who were survivors of torture, some of the most beastly international torture. You have helped so many people deserving of care in so many ways who so badly needed this, especially during this pandemic. Our community is hurting now, but you were there to help. We hope that these real-world experiences inspire you to make a lifelong commitment to using your skills and knowledge to balance some of the inequities that exist in our healthcare system. You are now part of the solution. You soon-to-be graduates came here in the summer of 2018 to be part of greatness. I came too in the summer of 2018, looking to be part of a great institution. Neither of us knew what the future had to bear, but both of us were excited to come to Penn that summer. Our lives and the world changed radically in 2020. It's continued to change. 1 million Americans of all ages have died of a disease called COVID. Many areas of routine life shut down completely. Penn Dental Medicine responded with innovation, science, and leadership. We owe a debt of gratitude to our faculty and staff who returned to the clinical care community, teaching and delivering care despite unknown risks at that time to their health, the health of their families, in an effort to provide the basic dental care that was necessary for people. Thank you for doing this. We have lots of gray-haired older people like me that were at higher risk, and the fact that they stepped out to do this is really quite a commitment to both education and patient care. Your clinical education resumed remarkably in June of 2020. As a matter of fact, we were the first school in the Northeast to return to care. Only 30 or 40 more pages. And our clinic safety manuals, then the slides start. Our clinic safety manuals, our virtual teaching techniques actually became the standards in schools throughout the nation. We presented on this over and over again as a faculty. Rather than compromising your education, you increased service to our community. You delivered care in our new personalized care suite, part of our care center for persons with disabilities, with a curriculum that has now become a national standard. You performed over 21,000 procedures during 5,300 visits in community oral health centers serving immigrants, aging, and underserved communities. You demonstrated caring and enthusiasm throughout. You spent the last 2 years socially separated, but were never separated from Penn Dental Medicine. We saw the resilience of the class of 22 as your education shifted at our school, but you continued both your education and patient care, all while we were forced to coexist with COVID-19. Out of this adversity, though, we saw schoolmates who launched food security programs, high school mentorship programs for students, things that aren't related to dentistry, but were related to dentists being leaders and doing good for their community. You sacrificed so much of your dental school experience to keep our community safe, but you still experienced so much more than those who came before you. In the end, I hope many of you will have the same choices I had: the opportunity to do residency training, PhD training, a career as a family practitioner, a researcher, a faculty, and in 2017, leave the familiar and head to the unknown. Experience a new place, do new great things. Take a chance. You should have applied for the dean position. Create a new world for future generations of dental students. You are becoming a member of a historic alumni who have demonstrated insight, innovation, impact for generations of patients and dentists in the future. And by the way, being the dean and graduating my first class of highly resilient, brilliant, and successful people like you is a pretty damn good reward. Over your 4-year experience, each of you demonstrated that you have outstanding character of a Penn Dental student, now ready to be a Penn dentist. Your curiosity, your intellect, your passion to serve those in need are readily apparent to your faculty, your mentors, and to me too. You've been educated by an eminent faculty dedicated to developing the science, not reading it, but developing it, and the clinical technologies not only of today, but that we'll be using for generations to come. But of the future, every dental school hopes to graduate good dentists. Most of the public actually believes that you came to dental school just to fix teeth, fight Mr. Cavity. I know you've learned much more in this path. At Penn Dental Medicine, you've partnered with your faculty to restore dignity, self-confidence, and pride in the patients we treat. You've helped restore function and maintain health, not just oral health. We get to make people smile, and that's an incredible privilege. You are fated for greatness. You are fated to become the future dental leaders. You are fated to become the future dental educators. You need to be great leaders in your community, no matter where you go or what you do. We are counting on you to do great things as the generations of Penn Dental Medicine graduates before you have. Become a faculty, become a department chair, become a dean, and of all things, be exceptional practitioners throughout the world. Recognize the contributions your family, your friends, and your school made to make you the person you are. As graduates, you join a new support system. Today, you join the elite ranks of over 10,000 Penn Dental Medicine alumni. I hope you will remember that you always have a place of support here in Penn Dental Medicine. Come back to us with your questions. Come back to us with your successes. Speak to us about the things that we can do better, because we always strive to do better. Just as you are now proud Penn graduates, or will be in moments, Penn Dental Medicine is forever part of you. Your careers will bring us pride, prestige to your alma mater. Stay involved with us, share your achievements, always put your patients first, and maintain your insatiable urge to learn. There is no limit to what you will achieve. Welcome to our profession, and now, smile. Thank you. Well, I would like to introduce our keynote speaker today, a dear friend, Mr. John Kemp. John became a colleague and friend of mine nearly a decade ago. He's widely respected for his many achievements in the corporate and nonprofit world and for his decades of experience as a leader in the disability movement. John currently serves as president and CEO of Lakeshore Foundation in Birmingham, Alabama, an internationally renowned organization serving over 4,000 unique individuals annually through their physical activities, sport, recreation, advocacy, policy, and research. Lakeshore serves as an Olympic and Paralympic training site, strengthening the ongoing commitment to development of para sports. John served as the National Executive Director of United Cerebral Palsy Association, General Counsel and Vice President of Development for National Easter Seal Society, and is a recipient of awards from every level of government, including America's highest honor for disability leadership and service, the Dole Leadership Prize, whose prior recipients included Nelson Mandela and former U.S. Presidents George H.W. Bush and Bill Clinton. John graduated from Georgetown University and Washburn University of Law and has used his education and life experiences to passionately advocate for disability community. He has accomplished items that few before him have attempted, let alone achieved. It is my privilege to work alongside him in these efforts, and indeed my honor to invite him to address you today. Quite honestly, John has taught me so much about disability, or a better term, ability, and looking to find the accommodation that could make all of us whole. John. Can I set anything for you, or are you good?
I think I'm good. Thank you, my friend. I'm overwhelmed, somewhat at a loss of what to say other than the few notes that I made for myself. They aren't as long as you think they might be. I am honored to be here with you today. Let me get some things organized. Distinguished leaders, students, class of 22, parents, friends, my wife is with me, Sam. Congratulations. If you were like me, when I got through law school, you had to stop and say to yourself, when you first applied, do I think I can get in? And then you say to yourself, after you get admitted, oh my gosh, I cannot believe I got in. And then you say, what did I do? I'm not sure I can make it. And then you go through a couple of semesters and you go, I think I can do this. I think I got this. And then you get through to today, and it seems to start all over again, where you're going to say, what am I going to do next? Can I do it? and then you'll become very comfortable in contributing to the quality of life of so many people. Obviously, I represent people with disabilities. But think about people with disabilities, some very severely disabled people that your dean and I know have not been treated very well in this world, especially when it comes to oral health. One of the most horrific things that I saw in my life was a busload of intellectually disabled people being brought to an emergency room at a hospital, some 75 offloaded, put into the waiting room to wait to be put under general anesthesia about every 15 months, 18 months, maybe as long as 5 years. Because dentists didn't know how to treat them. Because of Mark's leadership, UPenn Dental has provided a care setting and a clinic where you now have rotational experience addressing the needs of very complex people with disabilities. And if you can serve to the margins, you can serve everybody in between. You are way ahead because of this experience. And it touches your soul in very human terms about what it means to be of service. Some of you probably saw only 8 days ago an incredible valedictorian speech by Elizabeth Bonker at Rollins College, class of 22. Maybe you didn't see it, but I'm just going to share a little bit of what Elizabeth said. She is a nonverbal woman with autism. She was one of 5 valedictorians, and the other valedictorians elected her to give the remarks on their behalf. She had learned to type to be able to express herself because she was nonverbal. She said, "Life is for service." And she noted Fred Rogers, Mr. Rogers, who when he passed, people found a note in his wallet that said, "Life is for service," as a reminder to him to be of service to mankind. Elizabeth said, "Service to others gives meaning to our lives and to those we serve." It is not just about filling cavities. It is about touching the souls of the people you are going to encounter, the people you're going to meet, your patients, with and without disabilities. Elizabeth quoted Viktor Frankl, who, while suffering in the Nazi concentration camp in Auschwitz, where fellow prisoners shared their last pieces of bread, wrote, "Everything can be taken from a man but one thing, the last of human freedoms, to choose one's attitude in any given circumstances, to choose one's own way." Think of where he was and laying claim to the fact that you can choose your way. She quoted Alan Turing, who broke the Nazi code, who said, "Sometimes it is the people no one imagines anything of who do the things that no one can imagine. So be the people and be the light." That's Elizabeth. That's not me. And I don't think I'll ever be able to top her and her insight into humanity. We think about resilience. Think about where you have come from, the transitions of culture and language to this great academic institution. Quite remarkable. Mark and I started something with colleague of ours called Project Accessible Oral Health about 5 years ago to address the global needs of people with disabilities. And we found out that even the basic needs of people with disabilities were not being considered in medical settings, in dental settings. Primary doctors had never asked about the oral health needs of their patients, or even suggested seeing a dentist. Such a disconnect. 100% of their medical visits were covered, less copay, yet only 72% of their dental visits. The disparities still abound. While we must understand context where oral health fits within the lives of individuals with disabilities and our parents and caregivers, we must also appreciate the frustrations on the dental industry side in serving our population. Physical access to locations. How do I drive my scooter? And I use a scooter. I wear artificial legs as well. How do I get my scooter in and out of places? And some people actually ask me, does that thing have a reverse on it? Oh yeah, to get out of places probably where I didn't want to be. But physical locations, and look at the clinic and the movable chairs. People can ride their own chairs in and be served in most appropriate ways. The diversity, one size fits all, is just not true. We adapt to the people's needs in every possible way. So reading this very basic article about oral health, I got excited. Poor dental habits can have surprising ripple effects throughout your body. With good oral health, can have a sharper brain. Oh, thank God, I need it. I need it so badly. I'm practically out of Prevagen. Okay, I don't use Prevagen. Can have clearer lungs, lower risk for cancer, healthier kidneys, fatter wallets, because you're not spending it on emergency care, stronger hearts, lifelong sex. Hope I didn't offend anybody. Sorry, honey. Yeah. But we're talking about quality of life. What I love is the clinic here and the care center. Not a clinic, a care center. And to put it into context, the lack of proper training among dental students is among the most rooted health problems people with disabilities face. You are way down the road. Dental care is often the most difficult to find of any type of service for people with disabilities. Graduates must now be competent not only to assess the treatment needs of patients with special needs, i.e., I'm doing air quotes now, people with disabilities. Did you get that? Okay. But in treating the oral health needs of people with disabilities, it used to be just the standard of being able to assess, but now you have to be able to treat. Thank goodness. The clinic here provides that. But who are people with disabilities? There are about 60 million people with disabilities, and if you count aging into it, there are a whole lot more. We have a culture in disability, and it's not simply the shared experience of oppression. We don't go around saying, oh, poor me, I'm a person with disability, life's gonna be terrible. Are you kidding me? Hardly. Some people do, I don't. That's their choice. But culture has now found people with disabilities. The most compelling evidence of a disability culture is the vitality and universality of these elements despite generations of crushing poverty, social isolation, lack of education, silencing and imposed immobility. Core values, a heightened acceptance of human differences. Heightened acceptance of human differences. Just because I have a disability, I am so much more enlightened about other people of color, from other parts of the world, from different economic situations. I am more understanding and tolerant and appreciative of the struggles that they've gone through. So I actually am blessed that I have lived with my disability from birth. Got my first set of arms when I was 2, legs when I was 3, and in regular school at age 4. My mom died of ovarian cancer at 15 months, when I was 15 months old, and my little sister was 3 months old. My dad raised 3 of us kids. If there's a hero in this world, it's my dad. Maybe my other hero is my wife. It's hard to thank your parents enough, right? You go through that separation time where, oh my gosh, I don't want to be seen with them, I don't want to be with them. You can drop me off at the corner, I'll walk the rest of the way. And then all of a sudden, as you get older, you get a lot smarter about how smart they really are and how appreciative you are for what they've done for you. Another core value, interdependence, is part of our lives. How much I need other people in my world to live a great life, and you do too. You cannot go through this life all alone and isolated, and we learn this through our culture. Disability humor, something funny that's going to happen, and using humor to break down the barriers, because most people just don't know how to talk to us. They are so afraid. Kids are not afraid at all. They show up at the supermarket. I swear to goodness, they're given a license by the manager of the store that says, come on in and commit mayhem upon people with disabilities and seniors and ask them all these questions and have a nice day. And they run around and they find us and they start asking 7 questions. If you're 6 or 7 years old as a kid, you start asking me 6 or 7 questions. Can you hold this can of peas? Can you drive a car? Can you play basketball? Can you do this? And then they get to 7, they go like, that's about it, I'm done. Mom or dad happens upon this encounter, and they're freaked out that Junior is bothering this disabled person. Not at all. Who has a handicap and who has a disability? I have a disability. Parents are handicapped, have a handicap. Junior's doing exactly what a child that age is asking about, curious and wondering. But humor can be something so powerful and so good, as long as it's not self-deprecating. We have a sophisticated future orientation. I was asking Elizabeth and your wonderful staff, Margaret, and you, Mark, am I going to run into some barriers along the way? Just as your future patients are going to ask themselves, is your place accessible? Am I going to be able to communicate, if I'm deaf, with someone there who's culturally competent to address my needs? And you're going to say to yourself, oh my goodness, is Google Translate working today? Is sign language being able to be picked up by artificial intelligence and translated into text? Yes, all of those things are possible today. And we're gifted as a core value with the ability to read others' attitudes and conflicts in order to sort out, fill in the gaps, and grasp the latent meaning of contradictory social messages. What in the world is that? Emotional learning. We read people really, really well. We understand where they're coming from and what's going on in their lives because we're looking at the whole person. High IQ is estimated to be attributable to only 20% of life success, with 80% attributable to emotional intelligence, to understand and feel and to empathize with others and the circumstances in which they find themselves and you find them. Aristotle said, and I have a picture signed by Aristotle on my wall, by the way. Amazing, all right? He said, it is a rare skill to be angry with the right person to the right degree at the right time for the right purpose and in the right way. Otherwise, don't be angry, person with disability. Don't be angry. You're overcoming barriers and you're going to get through them and you're going to educate a whole lot of people who follow. Just think how fortunate you are to have met the people you have met at the care center who have broadened your view of humanity. No two people are ever alike, even among people with disabilities, and especially among people with disabilities. The equity for all participants in oral health and eventually general health is at the core of UPenn's dental inclusion. that the economic incentives to compensate dental health providers must be appropriate and sufficient to allow you to increase your census of patients with disabilities, and therefore include many more of us in your neighborhood practices, all of which begins to address the critical oral and general health care needs of our community. We've got a long way to go in policy to make this equitable. When the quality of our oral health and general health is improved through treatment by culturally competent providers in universally designed accessible dental offices, and with providing community health education that creates smarter patients with disabilities who do want improved oral health, we can fully participate in the educational, economic, and social mainstream of American life. So when I think about Elizabeth Bonker, and I think about you, my thoughts are, you have an opportunity to be the light of service in your communities. You've already started by being at Penn Dental. Now you have the rest of your life to be of service to humanity. Congratulations, class of 2022. Thank you.
Thank you, John. We really do want to make you like a faculty here at Penn Dental Medicine so that we can have ongoing interactions. And we look forward to spending lots of time with you, which I promise I will and we will. This is actually John's second time on the campus. He came here when our care center was just literally a dream. It wasn't even an architectural rendering yet. And we've been able to do so much. John, a memento of Penn, thank you so much for all that you have done. Thank you. So I've spent a career actually working on persons with disabilities, literally in my practice. From the 1982, I started seeing my first patient in my private practice, and kept that practice running until I came here in 2018. And I treated persons with disabilities for that entire time, as many as 600 visits a year. And yet, I learned how handicapped I was the first time I met John, and he stuck his hand out to shake my hand, and I hesitated because I didn't know what to do. And it's that growth that we all can have, and that you've had this opportunity to start with as being people. On to another subject. We have one of the sharpest looking people on the stage right now, is Captain Sean Meehan, professor of the Uniformed Services, University of Health Sciences, Department of Oral Diagnosis. He's a 1992 graduate of Penn Dental Medicine. Captain Meehan is the former dean of the Naval Postgraduate Dental School. For several years now, I've become friends with him since I became dean, and realized how many Penn Dental Medicine graduates served in senior leadership positions throughout our military. And we asked Sean, who's been in Washington, to travel up here to usher in the members of our graduating class in their new roles as members of the new members of the Dental Corps of the United States Navy, Army, and Air Force. So Sean will make a short presentation, and then actually there will be a swearing-in ceremony. Sean, please.
Well, good afternoon. First off, congratulations to all the graduates on this important milestone in your personal and professional lives. I also want to thank Dean Wolf for inviting me back to address you, the 2022 graduates of Penn Dental, and your families. It's truly a privilege, and I'm honored. So we're here today to celebrate two very special professions being embarked upon: Doctor of Dental Medicine, and also for some of you, military officer. To start off, I want to tailor a few comments to the graduates who enter the dental corps of one of the three armed services. And I would be remiss if I didn't attribute my inspiration for these comments to a previous Navy Surgeon General, Vice Admiral Faison, whom I saw deliver a similar address at a military graduation a few years ago, just before he retired. And I was so impressed and touched by Admiral Faison's comments at that time that I built this graduation narrative drawing from some of the ideas and sentiments he expressed. Hopefully, they'll resonate with you as well. So I now understand, I was told there were 19 graduates, military graduates. I understand there are now 20 graduates who will go on directly into one of the three dental corps, either Army, Navy, or Air Force. And that's out of 164 graduates, or just about 12%. And I want to say this is a very impressive number, given that the military comprises less than 0.5% of the United States population. So you are special for taking on the yoke of service in support of the national defense strategy and safeguarding the freedoms and liberties enjoyed by the population of the greatest nation in recorded history. In this service to the nation, you'll find that there is great sacrifice. There are deployments, long hours, family separations, and adherence to very specific and strict rules of conduct. In fact, there's a whole body of law that applies to you that is different than that which applies to your civilian peers. However, in this sacrifice, there are great rewards: pride, character building, leadership, camaraderie, and teamwork, and not the least of which, as dentists, is the opportunity to hone your professional expertise in service to our nation's warriors. And ultimately, for some of you, going on for advanced board-eligible specialty training sponsored by the military as you progress through your careers, continue your service. So now I want to make some comments directed to all the new doctors in the audience, not just those bound for the military. You're about to transition to assuming a role of trust as a healthcare provider. There are very few professions where one's job it is to take up the unusual act of laying one's hands on another human being, and you are about to enter one such profession. Inherent in this role is a significant degree of social and interpersonal asymmetry. That is, you will all soon be placed in positions of authority. All of you will heal people who are in need and who may be vulnerable, with the special skills and talents you've acquired over the last 4 years of your education and training. However, you need to keep in mind that your success or failure in today's world and going forward into the future will be determined by the care, the empathy, and the humility you embody as you approach your new role. It's about creating psychological safety for your patients and earning their trust so that they believe you'll do the right thing and always have their best interests at heart. Incidentally, for those of you who are about to become active duty military officers, you are delving into an additional level in this realm of authority and trust, and that is working with and caring for the sailors, soldiers, and airmen you'll be privileged to lead. Because military officership is at its core about leading people. To lead people, you'll need to guide them and see to and care for their needs and welfare, physical, spiritual, and emotional, to include mentorship, counseling, and instruction, with the same or greater diligence you exercise when you care for your patients. But whether or not you're a military graduate, it's paramount to understand that trust is a pivotal factor, one which will inform and define your success as you care for your patients. As every one of you, both military and civilian, progress through your career, you may at times become distracted from your responsibility to promote and ensure trust. After all, life happens. In your personal life, there may be marriage, children, aging parents, finances. In your professional life, there may be the running of a practice, paperwork, insurance claims, competition for advancement and promotion if you're in the military. all the types of things that can at times distract you from the core values of your responsibility as a professional and make you take your eye off the ball. So you'll need to occasionally recalibrate and remind yourself of the sacred duties you have in the realm of trust and the interpersonal responsibilities that are inherent in your positions, which I recommend you do regularly and intentionally, whether you think you need to or not, just in case you've drifted. So how do you recalibrate? So here's a brilliant exercise that Admiral Faison mentioned in his address that I referenced earlier, and I think it's so powerful that it bears repeating here today. So I'll do my best to paraphrase it and keep a straight face. It will involve audience participation, so let me just walk you through it. Everyone has a cell phone, right? Everybody has a cell phone. We all have cell phones. We all have smartphones. And we always have it with us, right? So that means that there are probably several hundred cell phones here in the audience. Many of these, we asked you to silence these in the beginning, but now I'm going to do something very unconventional and ask everyone to take out your cell phone. It's not a joke. Take out your cell phone. I'm probably the only speaker who will ever ask you to take out and view your cell phone when I'm talking. So go ahead, take out your phones. Now, we use cell phones for a whole variety of purposes in 2022. And one of those purposes is to take and store photographs. So I want you to go to the photo album on your cell phone now and find a photo of someone you love. Go ahead and do it. Now I want you to share that photo with someone who's nearby and explain why you love the person in the photo. Start talking, start sharing. I'll give you some time to do it. Okay, so now that I think we've had a good sharing episode, so I want to get back to the lesson here, so if I can have your attention. Here's a takeaway that forces you to remember the special trust others place in you and to remind yourself of the diligence you need to exercise as you care for them and their needs. Throughout your professional career, always remember that every patient you care for, and for those entering the active duty military, every sailor, soldier, or airman you're ever privileged to lead, is a photo in someone else's cell phone. Remember the love you just spoke of and heard about, and you will remember the trust that those you work with and those you treat have bestowed on you. So that's the lesson, and I think it's a powerful one. So let's move right on to the reaffirmation of the oath to the Constitution to mark the transfer from the reserve component to active duty and to honor the love and the trust. I'm going to ask military graduates to please stand up and raise your right hand. Also, if there are any current or former military members in the audience, you're also welcome to join in the oath. So raise your right hand and repeat after me. I state your name. Having been appointed an officer in the United States military, do solemnly swear that I will support and defend the Constitution of the United States against all enemies, foreign and domestic, that I will bear true faith and allegiance to the same, that I take this obligation freely, without any mental reservation or purpose of evasion, and that I will well and faithfully discharge the duties of the office upon which I'm about to enter. So help me God. So to all the graduates of the University of Pennsylvania School of Dental Medicine, class of 2022, welcome to the greatest profession on earth. And to those who will enter the military upon graduation, welcome to the two greatest professions on earth. Thank you so much for your attention. God bless you. God bless the profession of dentistry. God bless the United States of America.
Thank you, Sean, Captain Meehan. It's my pleasure to, we're getting near that graduation hooding thing. We're getting close, I promise. It's my pleasure to honor a very special person, a member of the Penn community, who has really been such an integral part of our communal health. It's Ms. Sharon Smith. Sharon, if you could come up. Sharon is the Associate Provost for University Life. In her role at the university, Ms. Smith oversees a number of campus support programs and endeavors to holistically serve students navigating Penn. She came to Penn in 1987, serving in various leadership positions throughout the campus, including Penn College Achievement Program, New Student Orientation, and Open Expression. She was instrumental in helping create a mission and framework of the Student Intervention Services Office, which leads university response to emergencies and critical incidents involving students. She earned her baccalaureate degree in psychology from Penn State and her master in counseling psychology from Temple University. For over 20 years, Sharon has been dedicated and passionate supporter of Penn Dental Medicine students, assisting our community with issues such as personal and academic emergencies, food insecurity, provision of urgent medical care, and critical assistance to our international students, just to name a few items. The Office of Student Affairs and I refer to Sharon as our guardian angel, who selflessly made herself available to work with us, not only during Sharon is available any hour, day or night for us, and we have used that. During this such important time during COVID, where we all felt an unusual stress, Sharon was there to help us deal with our stress and to help deal with the stress of our students. She embodies the very best humanity has to offer: wisdom, compassion, integrity, and dedication. I am so proud to present this special certificate of appreciation and recognition for your valuable contributions to the Penn Dental Medicine community. Thank you so much. If you'd like to say a few words, you may, but it's not necessary. Thank you.
Thank you so much. I'm so very honored to be a part of this community and to feel the care and compassion and share collaborative partnership with everyone. Thank you so much.
Thank you, Sharon. Really great. Now it's time to invite our president of the class of 2022, Dr. Abdullah Asi.
Thank you. Let me just take the other version of the speech. Good afternoon, Dean Wolf, Associate Deans, Department Chairs, faculty, staff, family, and friends. On behalf of the student body, I want to welcome you to the University of Pennsylvania School of Dental Medicine's commencement. Today, We are celebrating a milestone in our lives, which you were very much part of it. It took more than 8 years for most of us, while others are graduating from dental school for the second time. Thanks to all our faculty for constantly providing selfless teaching, guidance, and support. We are graduating as doctors. We are grateful to our leadership and Dean Wolf for keeping our school open during the pandemic. You have successfully transformed this institution into a leading DSO. My colleagues, this milestone we achieved is remarkable, outstanding, and something to be proud of. In those couple of years, you had to adjust to too many changes, from curriculum to new clinical hours to larger clinical groups to opening the new state-of-the-art patient care suite and promoting new green initiatives like installing a Tesla charger for those who have one. While we are grateful for the school being a pioneer during this pandemic, the past 2 years were unprecedented. The restrictions placed on us due to COVID have tested our sanity. We had to transition to virtual classes. Attending from bed was hard. We had to listen to our unmuted classmates snoring and witnessing Alexa trying hard to wake up others. During the past 2 years, we became expert hygienists, having to have hand scale. In fact, we will be the first class to graduate with no piezo experience. But we can now start a fire with a pair of toothpicks. This came with great sacrifices from us, such as only 2 days of spring break in the middle of the week, shortened Christmas break. I must say, this has prepared us well on how to endure hardship we will face later on in life. As we transitioned to clinic, we had to wear full hazmat suits with booties, hair bonnets, 2 masks, and a face shield. Our looks still remain a mystery to our faculty, even to this day. Despite all of this, we achieved high matching rates in residencies and finished our clinical requirements on time. We were able to succeed with a 100% written board passing rate with no structured study time built into our academic calendars. This is very impressive. All of this speaks to the caliber of our class. We had set new standards at Penn Dental. This was not achievable without the outstanding dedication of our didactic and clinical faculty. I want to acknowledge you for elevating our clinical training and experience. Your commitment was proven day in and day out. We appreciate you not losing sight of one of the school's primary objectives, dedicated patient care. We could have not made it through all what we endured without a lot of support from the staff at the school. Thanks to the IT team for being responsive to any technical issues that arose. Thanks to the clinical affairs team for maintaining supplies. Also, special thanks to the IMS team for going above and beyond, helping and providing for us. The clinic would not function without you. Starting a new chapter in our lives come with greater responsibilities. Going into private practice, public health, or residency requires leadership. This demands us to be great listeners and necessitate us to take proper action. Addressing your team members' suggestions and concerns is helpful to the overall outcome and the success of your mission. This may result in disagreement on how to accomplish the goals you set, but maintaining respectful discussion is imperative since every opinion matters. Imagine yourself as the captain of a ship. For the ship to get safe to shore, you must continue to listen to others, since you are not operating the ship alone. Coming out of this institution, you are exceptional. You were mentally, physically, and emotionally tested throughout these extraordinary years. Look around you and remember how you and your classmates banded together to finish the long list of CEEs and OSCEs. Spending late night at the lab, pouring up models, setting up dentures and partials, with dubious hope the case would return from the lab. In a year or two from now, you will encounter different hardships. Remember to lean on each other when we enter this working world and meet these new challenges. You realize the statement of a self-made man or woman is a myth. We shall be called to serve and support one another and the communities around us. It is imperative to remember that what we do in life echoes in eternity. Class of 2022, congratulations on a job well done.
Okay, thank you, Dr. Asi. We will now begin with hooding and awarding of the diplomas. Word of explanation, the hooding ceremony originated in Europe, European universities, 11th, 12th century, and was introduced to distinguished graduating students as they begin their academic careers. During the ceremony, it is a faculty member who places the doctoral hood over the head of the graduate, signifying their success in completing the professional program. The hooding ceremony is a symbolic of passing the guard from one generation to the next. To hood these students are several faculty members: Dr. Yu Cheng Chang, Director of Predoctoral Periodontics and Assistant Professor of Clinical Periodontics; Dr. Beverly Crawford, Director of Diversity and Inclusion and Associate Professor of Clinical Dentistry in the Department of Preventive and Restorative Sciences; Dr. Sumin Lee, Assistant Professor in the Department of Endodontics; and Dr. Najid Saleh, Associate Dean of Clinical Affairs and Professor of Clinical Restorative Dentistry. Dr. Faizan Alawi, our Associate Dean of Academic Affairs, will be distributing diplomas. Please proceed to get hooded when I call your name. You will be taking a photograph with Dr. Wolf. Please leave your mask on. There will be an opportunity after the ceremony outside to take a photograph, should you so desire, without a mask. Okay, so we will now start calling the names.
We do have the concern.
Yes.
We do have the concern that we may have inclement weather that would prevent that. If you wish to take a picture without your mask, please don't cough on me. I'll shake your hand. We'll take off our masks. We'll get that picture right now because I am concerned that we're not going to be able to do that.
All right. Okay, so we'll start calling the names. Dr. Hey, go on. Dr. Iyayi Omotesi Abokan. Dr. Osama Al-Abdallah. And Dr. Mahmoud El-Gilani. Dr. Mustafa El-Saudi. Dr. Dina Al-Awa. Dr. Setare Emma Amuzadeh. Dr. Abdullah Asi. Dr. Ryan Atlasi. Dr. Benjamin Babaev. Dr. Kayleen Beckley. Dr. Zara Beig. Dr. Pallavi Bansal. Dr. Sally Becker. Dr. Kaylee Leigh Baranowski. Dr. Carson Shane Beatty. Dr. Anthony Brady. Dr. Jeremy Budd. Dr. Dia Sabrina Chandra. Dr. Jennifer Megan Chen. Dr. Jessica Yiming Chen. Dr. Samantha Chiarello. Dr. Michael Simba. Dr. Enrique Corona. Dr. Eric Davis. Dr. Saxon Tyler Day. Dr. Cody Michael Dazen. Dr. Jessica DiSalvo. Dr. Saskia Marlene Dieudonné. Dr. Nhu Din. Dr. Andrew Michael Doberstein. Dr. Madison Eddings. Dr. Tiffany El-Malem. Dr. Shahed El-Tayef. Dr. Ryan Engel. Dr. Ivan Ivanish. Dr. Puria Farhadi Amiri. Dr. Julia Ferris. Dr. Krista Flanagan. Dr. Emma Claire Fontenot. Dr. Kevin Connor Franz. Dr. Viola Ganaptean. Dr. Miral Gandhi. Dr. Jamie Marie George. Dr. Sabrine Gill. Dr. David Scott Goodman. Dr. Casey John Gringer. Dr. Alfred Guo. Dr. Nitaka Gupta. Dr. Nada Hamoud. Dr. Jun Han. Dr. Brenna Catherine Harrington. Dr. Michelle Heiken. Dr. Megan Haggerty. Dr. Victoria Catherine Hein. Dr. Ramina Haiderlu. Dr. Rachel Heigberg. Dr. Andrew John Hallman. Dr. Rachel Hoy. Dr. Byron Hoop. Dr. Victoria Tiang Hu. Dr. Isabel Elizabeth Halls. Dr. Phyllis Ann Imiti. Now, Dr. Julia Rose Jagannath could not be here, but I promise I will call her name. So, round of applause to Julia. Dr. Tyler Kane. Dr. Ravneet Kaur. Dr. Caroline Kearney. Dr. Andrew Kelly. Dr. Gohar Kodadust. Dr. David Tawit Kim. Dr. Joshua Kim. Dr. Min Young Kim. Dr. Brandon Leib. Dr. Stephanie Labib Awad. Dr. Eugene Lam. Dr. Brianna Ledoux. Dr. Alisa Eung Lee. Dr. Cindy Lee. Dr. James Junsu Lee. Dr. Tina Marie Lee. Dr. Maggie Yutian Lee. Dr. Alberto Luis Lemos Novo. Dr. Nicole Ashley Levine. Dr. Xiao Li. Dr. Angela Lowe. Dr. Emma Catherine Jiangyin Lo. Dr. Kevin Kaidan Lu. Dr. Ankita Premkumar Lula. Dr. Patrick Lynch. Dr. Ifra Malik. Dr. Janice Meyer. Dr. Sana Mohammed. Dr. Laila Mohammadamadi. Dr. Faizan Matuwala. Dr. Tahina Mukit. Dr. Isra Munir. Dr. Lindsay Nagy. Dr. Ryan Natal. Dr. Uchenna Ndukwe. Dr. Alan Wynn. Dr. Min Wynn. Dr. Nasreen Obeid. Dr. Shin Yu Oh. Dr. Richa Panara. Dr. David Yang Min Park. Dr. Shivam Patel. Dr. Tosha Maheshkumar Patel. Dr. Zalak Patel. Dr. Ayushi Vijay Pola. Dr. Sophia Marie Porach. Dr. Emily Louise Porcelli. Dr. Viviana Portillo. Dr. Evgeny Prosk. Thank you. Dr. Yao Si. Dr. Salman Qureshi. Dr. Sunil Reddy. Dr. Nur Rahman. Dr. Morgan Rhodes. Dr. Madison Elise Richards. Dr. Yumi Rivas Quintero. Dr. Tamar Rogozinski. Dr. Ariana Romero Guerra. Dr. Matthew Rose. Dr. Patrick Anthony Rossi. Dr. Saliha Sayed. Dr. Donatas Sandergas. Dr. Christina Michelle Sanchez. Dr. Erkina Saltabaeva. Dr. Sylvia Nagy Sauris. And Dr. Sylvia Nagy Sawiris. Silvana. Dr. Emmeline Schaefer. Dr. Kylie Schlesinger. Dr. Dallin Schneff. Dr. Jeremy James Schwartz. Dr. Simi Shah. Dr. Nora Sharif. Dr. Janet Chang Shear. Dr. Min Kang Shin. Dr. Asad Aftab Siddiqui. Dr. Faith Simu. Dr. Nicole Slavosky. Dr. Alexandra Caitlin Stein. Dr. Sarah Steinbaum. Dr. Paul Hawan-So. Dr. Sangmitra Suman. Dr. Alexander Takshin. Dr. Meika Isabel Tan. Dr. Lisa Tandukar. Dr. Muhammad Agia Tarbush. Dr. Taha Maha Tayefe. Dr. Jason Homing Tong. Dr. V. Nyen Tran. Dr. Kate Eaton Trishman. Dr. Gideon Turk. Dr. Mirtha Maria Veloz Hernandez. Dr. Mark Volker. Dr. New Vu. Dr. Kant Wu is not here, so please recognize him. He was unable to be here. Dr. Lauren Yen. Dr. Anisha Yaram. Dr. Shan Yu. Dr. Yin Su. Dr. Megan McKenna Ziebelman. We're now going to, when done with, okay. I'd like to before we go to the graduate students, I'd like to take a special moment to recognize all the students who have completed an honors program. Please stand. Congratulations. We will now recognize Masters in Science in Oral Biology recipients and Doctor of Science in Dentistry graduates. Dr. Muhammad Abukar, Dr. Abdulaziz Al-Hossan, Dr. Abdul Rahman Al-Malki, Dr. Chrissy Butari, Dr. Kushaldeep, Dr. Thomas Han Yob-Yu, Dr. Wael Fares Islim, Dr. Nur Katkat, Dr. Lin Musharbash, Dr. Salome Owusu Frimpong, Dr. Naela Al-Balushi, and Dr. Ala Babir. Congratulations to class of 2022. Okay. Before leaving, we have one very important part of the ceremony. I would like to introduce Dr. Rupali Kulkarni. Dr. Kulkarni is a 2019 graduate of Penn Dental Medicine and a 2021 graduate of the Oral Medicine Advanced Dental Education Program. She's also a new faculty member in the Department of Oral Medicine and has already been recognized by class of 2022 with the Earl Bank Hoy Teaching Award. And having known her from freshman year, I can tell you that all the accolades are well deserved. Dr. Kulkarni will lead the graduates in the Penn Dental Medicine Professional Pledge. Dr. Kulkarni.
Thank you so much, Dr. Ngorski. Class of 2022, you made it! This is, of course, everyone's favorite part. The hooding was just the beginning. So I'm very honored to lead you in your professional pledge. So please rise and repeat after me. As I enter the dental medicine profession, I vow to keep this pledge and these stipulations. I understand that my primary responsibility is to my patients. To the best of my ability, I will embrace the highest standards of oral health care and treat all individuals under my care with respect and honesty. Their total health and well-being shall be my primary concern. I accept the responsibility to maintain my competence through the continued pursuit of new knowledge and skills in the practice of dentistry. I will conduct myself with integrity, treat my colleagues with respect, and wherever possible work to advance the oral health of society. I shall faithfully observe the principles of ethics and codes of professionalism encountered during my dental training and beyond. All this I pledge with pride in Penn Dental Medicine's heritage and my commitment to the profession and the public we serve. We made it. Congratulations. You may be seated.
Congratulations to all our graduates. We have a small reception. I'm not sure what the weather is, but we do have a reception right outside in the tented areas. And what I would like you to do is, for the audience, please wait until our graduates had the chance to leave before departing the hallway. Thank you so much.